Having an annual well woman exam has been something that we have felt very strongly about through the entire pandemic. And OB-GYNs have really encouraged their patients to continue with their annual wellness screenings. Well woman exams encompass a variety of different screenings, not only cervical cancer screening or a pap smear, but also important screenings for breast cancer and general health wellness, as well as tips for how to maintain health in the future. Finding the right doctor in any specialty is always an individual decision. There are many factors that go into these sorts of decisions. Obviously, insurance coverage is a big portion of what dictates the physician you're going to see. But if you have an option to select a physician without having to worry about insurance coverage, really you should find someone that is well respected and that has a personality that meshes well with your own. There are lots of options for patients who don't have insurance in terms of maintaining their health and wellness. There are quite a few clinics that offer discounted plans or discounted visits for patients that don't have insurance. And other important screenings like mammograms are given cash discounts by the facilities here in town. Having a good relationship with your healthcare provider is paramount in terms of feeling comfortable during a pelvic exam. Pelvic exams are understandably awkward and uncomfortable for all patients. And good OB-GYN providers that are well trained and that have good relationships with their patients do everything that they can to make these a more comfortable experience. General women's wellness exams are typically recommended to start at age 21 or with the onset of sexual activity. Obviously, women younger than 21 can still come to see a gynecologist if they are experiencing problems with their periods, if they need STD screening, if they need contraception, or for any other problems that might develop. So during the pandemic, lots of women had chose to delay childbearing, and contraception was one of those things that has been essential throughout the entire pandemic. Most OB-GYNs here in Las Vegas continue to provide contraceptive services, including placements of long-term reversible contraceptives for patients who weren't ready for a pregnancy. Pregnancy care has also always been essential, and women who chose to have a pregnancy or had an unintended pregnancy during the pandemic still had the option to receive good care. Pregnancy care has always been something that's very vital, and OB-GYN physicians understand the importance of having good prenatal care. Cancer screening overall in general is something that is very important to maintain. Breast cancer screening in the form of a mammogram or an annual breast exam by a trained physician is very important to continue in terms of reducing the number of later onset breast cancers. Breast cancer screening and mammography is good at early detection of breast cancer, which provides better outcomes for patients. Routine colonoscopy screening or other colon cancer screens are also very important to maintain. These can help to detect early colorectal cancers, and this allows for better treatment and better quality of life for patients that are diagnosed. So patients should feel very assured that visiting a physician's office is one of the safest things that they can do throughout the course of the pandemic. Physician offices from the very onset of the pandemic in 2020 have been cleaning, they have been sanitizing, they have been requiring mask wearing well before it was mandated by any other entity, because our patients need to feel safe and they need to understand that medical care is important and that receiving that medical care should not be something that they should be anxious about. So there are several red flag signs that OB-GYNs consider need for emergent appointments. A patient who has a positive pregnancy test, who has heavy vaginal bleeding or sudden onset of abdominal pain requires emergency attention. Women who aren't pregnant that have bleeding with their cycles that that lasts for more than 7 days or causes them to soak through more than one pad or tampon per hour is also very important to receive emergent treatment. Women who notice changes in their breasts also need to have evaluations, specifically new onset of redness or tenderness or swelling, new masses in the breast, or changes in the nipples. Patients who have any sort of medical concern need to be prepared to talk openly with their physician about it. Physicians are willing to listen to patients' concerns, but patients also have to be willing to discuss them. And when I ask my patients if they have questions or concerns, many times they often respond, "Oh, everything's fine. No, everything's the same." It's hard to diagnose problems if they aren't presented appropriately. Patients need to be able to present problems or concerns in a concise way, knowing that physicians have a limited amount of time to meet with them face to face.